For the subcutaneous injections, most commonly we're using a subcutaneous injection for anticoagulants or for insulin. Your most common locations for administering a subcutaneous injection are going to be the fatty parts of the body. So we're thinking subcutaneous tissue. Most commonly, we see the backs of the arms, we see the tops of the thighs, or we can even use the abdominal area 2 inches away from the umbilicus. And for our subcutaneous injections, the angle is typically 45 or 90 degrees. And what makes that difference? How do we know, do we use a 45 degree or a 90 degree angle? We are administering a subcutaneous injection, meaning that the injection is going into the subcutaneous tissue. If you have an individual who is very frail, doesn't have a lot of subcutaneous or fatty tissue, we would want to use more of a 45 degree angle. If you have someone of typical size or who has plenty of subcutaneous tissue, then we can do a 90 degree angle or straight up and down. Okay, so for technique, we're going to want to wipe off that area with our alcohol swab. Okay, so we're finding our location. We're going to wipe off the area starting in the center, working our way out. Allow that to dry. And then we are going to go in at either a 90 degree or 45 degree angle. For this demonstration, I will do 90 degrees. And I want to make sure that I'm pinching up that skin because I want to make sure that I'm getting into that subcutaneous tissue. So I've wiped off the area, I'm pinching up the skin, and I'm going to go in at a 90 degree angle, inject, and then I'm going to let go as I'm pulling out, and I'm going to dispose of that into my sharps container.